community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Well, very fun topic that we're going to be discussing today on the show. I have a very special guest joining me in the studio. First show for me. Not my first time interviewing HSA. I've had a lot of doctors in the studios before, so I feel privileged to have Dr. Linden Swan here in the studios. Sir, how are you doing, first of all?
Very good, thank you. Thanks for inviting us to share on this important subject of common childhood illnesses. We are seeing a significant lots of very unwell children during this season.
You're not telling me. I have 3 kids of my own. Now, obviously, we'll discuss further on why this is going to be a very important topic today. But I do agree with you. I find that a lot of kids are now being held out of school or calling off sick because they either going through a flu or maybe all the symptoms are different illness that they're facing. But, you know, where I want to start, Doctor, is just tell us a little bit about yourself and your role.
Good. I'm a consultant pediatrician at the Health Services Authority. I've been there for over 18 years. I've been in pediatric practice for close to 20 years and qualified doctor for over 25 years. So I've seen lots of kids over the years.
Love that. And you said how many years have you been practicing?
Over 18 years here in the HSA.
That's a long time.
Correct.
It's a very long time. As we're in the midst right now of course, flu season, I think one of the important questions that we want to ask is, can you give us an overview, Doctor, of the most common seasonal illness affecting children this time of the year?
Right. We are in this, what we call the flu season, flu and cold season, and there are lots of viruses in circulation. The most important would be the influenza virus, which causes the flu, influenza. And the one we're seeing significantly right now, influenza A. Quite a lot of persons are coming down with the influenza A virus. I mean, there are 4 main influenza viruses, A, B, C, and D. So the important ones are influenza A and B. And this season, we are seeing influenza A has been taking a toll on the children and adults, taking a toll. Whether it's a more virulent organism, a virulent germ, we don't know, or whether it's our immune systems are more susceptible to these organisms. But it's really taking a toll. Very sick persons, very sick children, hospitalizations increase. And it's not just in the Cayman Islands. Throughout the Caribbean and worldwide, we're seeing this trend in this during this season.
Would you blame that, Doctor, on poor diet? Do you think the food is changing significantly, and that's perhaps what's causing it? Just a random question I'm putting out there because I see kids are eating just anything these days.
Correct, and you're right. That's a really good question. I would see that in the context of how can we prevent illnesses and boosting our immune system. And it will not be a bad thing for all of us to be boost our immune systems by controlling our diet, eating healthy, more fruits and vegetables in our diets, being better hydrated, drinking more water, etc. So those are some important things. Even, so diet is important for all, most of the other illnesses and chronic illnesses, and even boosting our immune system for these acute viral illnesses.
Yeah, it's great because one of my brothers that live in New York City was once telling me that whenever his son, he stopped him from eating fruits here. And I said, why? It's really good for him. You should have him try it, and eventually he did. But he was concerned while he was still eating the fruit. He said, Dane, when I have him eat a fruit in New York, for some reason, he gets an automatic allergic reaction. But here, completely different. So he is thinking that there's perhaps some things being sprayed on the fruits over there, and just not as organic as it is here in the Caribbean. So the reason I asked that question, doctor, is because I do honestly feel, I'm no expert, I'm no doctor here, but I do feel like a lot of kids are not taking in a lot of intakes in fruit, smoothies, or anything like that.
Yes, we really need to improve in our intake of fruits and vegetables generally, and the diet is often very poor, with more, fast foods, which are filled with lots of chemicals, food dyes, food colorants, preservatives, chemicals to make it taste nice, chemicals to keep it soft, etc. So there are lots of chemicals in the food. So we have to, if we can cook something at home, some fresh pot of food in the morning, have it home cooked foods, and have more fruits and vegetables, it will be best for all of us.
Love that advice. Let's start, doctor, with the flu. And how can parents tell the difference between the flu and a common cold? I think that's a big question for parents.
Yeah, it's usually, the common cold is a milder illness, lasts for 2-3 days. And a little runny nose, stuffy nose, probably a low-grade fever, sore throat. But the flu, when you have it, you're aching, your bones, your muscles, headaches, sore throat, high fever, and you're just not well. And that would last probably a week or even 2 weeks. So it's a more, you're sicker with the influenza or the flu, and less sick with the common cold. The viruses that cause the common cold also are different. You have the parainfluenza virus and some other viruses that cause the common cold every year or year round, whereas the flu caused by the influenza virus, influenza A and B mostly. And therefore, the difference is not always easy to determine and to differentiate. But generally, rule of thumb, it's milder with the common cold, the symptoms, and last shorter duration, and more severe with the influenza, with flu, and they last a longer time.
Yeah. Now, this one is a question I always aim to ask questions I think parents would like to hear, and just know how they can kind of pivot in their household. A child, common or a flu, common cold or common flu, do you recommend a parent, if they find out, they wake up in the morning, they see their child is not feeling well, do they still send them to school?
They should not, because you're spreading the virus more. And some parents will say, well, they brought it from school, so they're taking it back where they got it from.
Exactly.
and they might be right. But the truth is, you want to probably halt the spread now. You have that power to do that by holding that child back from school for a day or two. Also, sometimes we see some parents try to send them out because it's not convenient. Sometimes that parent has to go to work. They're the only one, there's no sitter, nobody there, a nanny to keep that child home. And they try to, perk that child up with some hydration and send him to school, and the child gets worse at school.
Yeah.
And it causes more inconvenience because they now have to leave work in the middle of work, go and get that child, and etc. So sometimes they try to take the child, but if you can keep that child away, it helps to protect both the child and others from the child. Teachers who will be exposed to other children in the class, etc.
Yeah,
in the schoolroom.
I tend to find that it also, doctor, it prolongs the illness, because I'm under the assumption that you need to rest in order to get this out of your system.
You need to rest and hydrate.
Yes.
you need to rest and hydrate. That child might go to school and run around in the sun. They become dehydrated, etc., and it will prolong that illness.
Absolutely. We have HSA here in the studio. Dr. Swan is joining us from HSA. Really good discussion that we're having just on kids and common flus and illness that you perhaps know about or you don't know about. Something new for me is the illness around RSV. New for me. I've never heard of this before. Right. So break it down. Explain the terminology.
It's just for the respiratory syncytial virus, RSV. And that's a very important virus in young children that causes what we call bronchiolitis. Symptoms of runny nose, fever, cough, cold, congestion, and wheezing, most importantly. Yeah. The RSV virus causing bronchiolitis. And a few months ago, it was quite an important infection. Lots of children were affected. And this last season, it was even more important because we saw very young infants, 2-week-old babies, 3-week-old babies being affected. And usually these might have some immunity. And so it's a little worrisome that we're seeing changing in the viral, load and how persons are being affected in these. It's a little worrisome. It was a real bad season. The RSV virus infection, which causes bronchiolitis. Luckily, however, probably next year, we might be able to immunize against RSV virus.
Oh, wow.
Yeah, immunizing pregnant mothers, which will protect their young, their offspring, their babies. And then the very vulnerable one, like if a baby is born premature, we normally will give them some prophylaxis during that RSV season. But it is a large portion of the population is still left unprotected. And elderly also will benefit from the vaccine, which hopefully can come in a year or two for the next season.
That's relief. I love that.
Yeah.
That's a big deal. I love that. Absolutely love that. Here's something that, sorry, you have something else to add?
I was just saying, but the RSV virus causing bronchiolitis, it can be mild or very severe. It might just be a runny nose and a little cold-like symptoms, or it might have a child end up in the hospital with severe wheezing and respiratory distress, and in some jurisdictions they end up on a ventilator. But luckily, we don't see that here.
Okay, that's good. But you do urge for parents to obviously look out for it.
Absolutely.
All right. Also, doctor, this is one that I am extremely used to. I feel like every year you don't know the school year has started until you get this email from school. The hand, foot, and mouth disease.
Right.
Can we explain what it is and how does it get spread?
Hand, foot, and mouth. And the name comes because you have symptoms in the hand. You have vesicles or lesions in the palm of the hands. You have lesions on the foot bottom and the soles of the feet. And then you have lesions in the mouth, small sores.
Where's all of this coming from?
It's coming from a virus, enterovirus. In our part of the world, it's a Coxsackie virus. In other parts of the world, in Asian countries, it's also other types of enteroviruses. And again, children, young infants can be affected, and young children with fever, just fussy, unable to eat because they have these lesions in their mouth, which are very painful.
Yeah.
And then it's obvious they also can have a rash on their body, and you can probably see these lesions, vesicles, etc., on in the sole of in the palm of their hands and on the sole of their feet, and it's extremely contagious. So you can have. We've had the entire daycare being closed down because of hand, foot, and mouth disease. And it's caused by a Coxsackie virus. And we don't have a vaccine for that, so prevention is taking precaution. If your child has hand, foot, and mouth, they should stay away from school.
Yeah.
And also you want to ensure that they're hydrated, treat the symptoms with some paracetamol, etc. Let them hydrate well and rest again. There's a vaccine Chinese have produced a vaccine, and it's used in China because hand, foot, and mouth in certain Asian countries is worse. Some of them get meningitis and encephalitis. Luckily, we don't see such severe disease here.
Yeah.
And so they have a vaccine in China.
Scary word to just use in the email to parents every time they see it. So they get very concerned. Is this a large number of cases that you see here on the island?
Oh, yeah, definitely. And it is interesting, for want of a better word, that you're seeing increase in all the viral illnesses. Hand, foot, and mouth, RSV causing bronchiolitis, influenza, and you name it, it's there. Increased numbers over the past year and two.
And would you say to a parent that has a child, unfortunately, that might be going through this right now, do you contain yourself too? Do you avoid going to work? Do you work from home if you find out your child also has this?
Yeah.
But just to take care of them. Obviously, you don't want to go to work and have anybody, or this is just something that's found with kids.
Correct. And lots of adults are being exposed also, and they will be coming down with some of these bugs.
All right. Listen, we have a very special doctor in here. I feel like I'm learning everything today. We're going to be taking a break very soon. Dr. Swan is joining us from HSA, and one that I wish on no child is ear infection. Tend to be more common in colder months, but it is something that is common here on the island. I know my child once got it, and as I hugged him and given him some medication and put some eardrops in his ears, I tend to say to myself when I was holding him tight, I'll take this pain for you, because I wish earache on no one, right? So is this something that parents, because the reason I'm asking this, doctor, is because I was one of those parents that said, I'm going to give you this tablet for pain, and I'm going to hug you tight, and I'm going to hope you fall asleep. But should parents seek medical attention right away for earaches?
Right. Often some ear infections are viral infections, coming again in these flu season, winter months, from October to March, the colder months. But often after your system has been, you've had a viral infection, you're more vulnerable. Viruses, make you more vulnerable sometimes, and then you can have that ear infection being a bacterial ear infection. So another germ takes over after the viruses have done their job, and then therefore you need antibiotics to treat that ear infection. It can cause, rupture of the eardrum, and this, recurrent ear infections can affect a child's hearing, which can affect their speech, which can affect their development. So we don't take ear infections lightly. It's one of the very common things in pediatrics to examine a child's eardrums, and therefore, usually it can be a viral infection. But if a child complains and has symptoms, pain in the ear, etc., it should be examined to see if the need for antibiotics to protect it from getting worse and complicating.
Yeah, great conversation. So definitely you would urge a parent to seek medical attention just to be safe.
Yes.
Just to be safe at all times. Listen, we're coming up to the break time right now. We do have a Dr. Swan here from, of course, HSA. We're having a wonderful conversation. We've touched on the cold, the flu, stomach virus, mouth, foot, and what is it?
And foot and mouth.
and foot and mouth disease, and just different things that you've heard about, you've dealt with, or you perhaps never want to deal with as a parent. But either way, we are discussing it here on Bobo, and we'll be right back after this commercial break.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Okay, and we are back with, of course, our lovely folks from HSA. We have Dr. Swan here joining us. We've had some wonderful discussions just around cold and common flu, or I say common flu, or common cold and flu season. And also we've been talking about ear infection. There's different things that you may deal with your kids during this season and what to look out for. The one I want to touch on now, obviously, is also a big topic, is a stomach bug. Also seems to be making the rounds during certain times of the year. Now, doctor, what are the main causes and how can it be managed at home?
The common stomach bugs we see are rotavirus and also the Norwalk virus or the norovirus. The rotavirus is, we have an immune vaccine against the rotavirus. We give it at 2 months and again at 4 months. And so that has really prevented the severe symptoms. Years ago, we used to see children severely dehydrated. I mean, eyes sunken, lips dry, bone dry, severe dehydration from the stomach bug gastroenteritis, which is basically vomiting and diarrhea. And a child can lose, 10, 15% of their body weight by just losing all that fluid, vomiting 5, 6 times a night, having 6, 7, 8 watery, large stools. They lose a lot of fluid. They become severely dehydrated. Therefore, you need to rehydrate them. Sips of fluids, sips of liquids, with, as whatever they can take. If they might be vomiting too much, they wouldn't be able to take much. Therefore, they would need like an antiemetic, which will be given at the hospital. But with mild symptoms, at home, you can just give them some fluids to drink, sip little by little, which sipping the fluids help in terms of not vomiting. You don't fill the stomach too fast. If they drink too fast, they'll vomit again.
Yeah.
So just sips of fluid can help, and treating the other symptoms of the flu, fever, etc., pain. But in many cases, it gets out of hand, and you cannot control that. That vomiting is so much, and nothing can be kept down. And the diarrhea is so much, they become severely dehydrated.
Oh, wow.
They would need to be brought to the hospital, therefore, for intravenous fluids. You set an IV line on them, intravenous line, give them some IV fluids to rehydrate them, to perk them up again. Give them, and that will help. And sometimes they might need to be admitted for further rehydration. Luckily, we are not seeing the severe symptoms of rotavirus because we have a vaccine against it. But every now and again, coming from the cruise ships, and you have an outbreak sometime, is the Norwalk virus, which we saw. We've been seeing a couple of months ago, we saw quite a few cases of the Norwalk virus. And that's, any clustered environment like a cruise ship, etc., you can have the Norwalk virus. And we did pick that up in our testing over the past couple of months.
Yeah. Now, what do you said mild before, but what are we looking out for, just in case anybody missed it? What are we looking out for if it's severe, if we know for a fact we got to take our kid in to the hospital?
Once a child is not tolerating orally, they're vomiting so much that you cannot replace their losses, that you will need to seek help. Yeah, you will need to seek help because their losses are more than you can return, give them back that amount that they're losing. So you need to seek some help. And that would be giving them some intravenous fluids to restore.
And parents, I really want you to take this, take this as something that's urgent, right? Because I do know a lot of parents that say, look, I'm also at the same time dealing with the cost of living here in Cayman, and I don't want to go to a doctor and have to pay for a doctor because of this. But these things can lead to more serious conditions, or worse, I don't want to say the word, but you can have perhaps your child end up dying because of something like this. Am I saying too much by saying that? Am I overstepping by saying because of a stomach virus, and if it's not taken care of by a doctor, it can lead to that? Or
yeah, I mean, severe dehydration can lead to severe morbidity and mortality. So you're right. We need to take it seriously. And as I said, a mild situation, if the child is just vomited once, you can restore that with some fluids at home, probably oral fluids or twice, and just one bowel movement, and they're still drinking, you can restore that with some fluids. But you will see that if it's beyond that, they're not tolerating anything orally, they can't drink anything, they're just vomiting everything out, and their stools are so much, and they're losing so much fluids, their body fluids. You'll need to seek some help to restore that.
I see that the doctor, he put his medical degree to use. I said the word died as a very harsh word, and he found a way how to, yes, but...
Dealing with children, we learned to, be a little more euphemistic dealing with parents and children and parents of children. We tend to watch our language a little bit.
I love it. I'm learning so much from you today already. Listen, one of the things I wanted to, because you mentioned vaccine earlier, what are some of the most important vaccine for a child to be taken right now, obviously to avoid any of these symptoms that you're talking about today?
Right. Well, we have what we call our routine childhood immunizations, and I think our coverage is very good with that, with those, including the rotavirus against the vomiting and dehydration, diarrheal illnesses, the DPT, hepatitis B, which is diphtheria, DPT, diphtheria, pertussis, which is whooping cough, and tetanus, and also the measles, mumps, and rubella vaccinations, hepatitis B, etc. So those are routine childhood vaccines, and the coverage is very good. We must commend our parents and our population for sticking in there and taking those vaccines. Though we know in many parts of the world there's a lot of pushback against vaccines now. There's so much, and persons, since COVID, etc. But during the flu season, I think what we need to look at is the influenza vaccine, in which we don't usually, most persons don't take the influenza vaccine.
Oh, wow.
And it's good from 6 months a child can have the flu vaccine. And I think what we learned from this flu season, it was so aggressive and so many persons were sick and so many persons hospitalized. I think we probably need to revisit that, and most of us need to probably have the flu vaccine. And it's good from 6 months a child can have the flu vaccine. And it's 1 dose or 2 doses, depending on if you have one before.
So good. So good. What about parents that are against vaccine? What do you recommend to those parents that their child should be doing in the home in order to avoid flus or any type of different virus that are going around?
Yeah, as you mentioned earlier, boosting your own immune system is so important, and that is, good, being in good health. Nutrition, very important. Adequate nutrition, good weight control, proper hydration, and being in good health. And then you want to hand washing, personal hygiene, hand washing, isolation if you're unwell, etc. And don't go out there and spread it to others, cough etiquette, etc., things like that. I mean, we see like in daycares and preschools, the entire daycare comes down with an illness because those young ones at 1, 2, 3 years old, they don't know basic things like cough etiquette. They cover their nose and their mouths and so on. They spread all their germs. They share their saliva among each other, etc. And basic things like that. So we see much more infections among the preschoolers because of that lack of control.
Yeah.
But as you get older, you can teach better control, etc.
I love that. Now, doctor, I want to ask you this because there's a lot of times that, as parents, we're home, we're with our kids. We know when they're sick. We know when something is off. We know when something is wrong. We may look at certain things on the scan or the way that they're moving, or they may be complaining about a certain pain that they have in their legs or in their stomach. I want you, as a doctor, this is their way to get all the right questions answered. What are some of the things that you say to yourself? No, if you're seeing this in your child, some of the common things, you need to take them to a doctor. If they're complaining about this, if they're complaining about a leg pain, or Maybe you have a boy child, and maybe in his private area, he's experiencing something there, like a rash or some. You know what I'm saying, doctor. Parents want to take their kids to a doctor for anything, right? But what are some of the common things you look out for?
Right. One of the things, the rule of thumb we use is that parents know their children. And that is important,
Yeah.
you know. They know their children. They know when their child is well, they say, you know, he always plays. I can know he's not well today because little Johnny is sitting in a corner. That's not him. He would have been, you know, outside, running around, playing with his toys, driving his truck, etc. So it's important for us to probably spend a little more time and know our kids, know what it is like when they're well. And so we can start from there in terms of knowing our children. There are certain things like, I know one of the more important things, acute infections you need to deal with urgently. You know, chronic problems, you can make an appointment, etc., and see a doctor for another. You know, some headache that is mild but worrisome at school, etc., or some other little lump or bump that can wait and be assessed later. But fever is always something that causes a lot of anxiety, you know, and you want to, if it's not being controlled with paracetamol or Panadol or other antipyretic, you know, within 1 or 2 days of giving that, it's probably more than just a common cold or just a little flu that will run a course of 2-3 days. It's probably complicating. So 24, 48 hours beyond that, a child is still, you know, unwell, not eating and drinking, still having a fever. You probably want to have that child checked out. In terms of as I said, other symptoms, it can be so many other symptoms.
Yeah.
But so you will know your child in terms of a limping child, as you mentioned. You know, is that an infection? Is that a trauma at school? Is just a little leg? You know, you will do your initial checks and see there's no swelling, nothing. And why is he limping? Is it something severe in the hips, say, an infection or something like that? So, I mean, knowing your child is important. And and it's trying to find that balance. You're right. Running to the hospital with just a little fever, the first time of fever, probably is no. Probably we go to the hospital sometimes a little too often.
Yeah.
So you probably want to try a little bit of antipyretic before.
Yeah.
And most viruses and bugs, you know, you'll get some support with that. So after a day or so of a symptom or 1 or 2 days, then you should probably seek help. But within the first 24, 48 hours, some trial of some meds at home.
Yeah. It's funny because my wife looks on Google for everything that comes
Dr.
up.
Google.
Yeah, Dr. Google. And it's usually Dr. Google is not as good with his words as like you are. So sometimes you do see that being thrown around that, oh, it may be this, and you don't want to hear that word cancer and just different things that pop up on Google, because a search is giving you all the alternatives, right? The things that could obviously take place. I once heard a parent said, my child is drinking too much water. I'm concerned. And usually because they say that this might mean that he's diabetic or something. Yeah.
Diabetes,
What do you say about that?
If you have, it's not just drinking a lot of water, but the other symptoms that go with that. Is he passing a lot of urine? He or she passing a lot of urine? So you look at the entire picture. You look at the full picture. Is he losing weight? Is there weight loss involved? Is he, along with drinking a lot of water, is he or she losing a lot of weight?
Does it cause weight gain also?
History? Not really.
Okay.
In children, you have 2 types, type 1 and type 2 diabetes. So type 1 is insulin dependent, is which we see in the younger children. And type 2 is more in the older children, we're seeing at a younger age now because of increased, obesity problems.
Yeah.
But so you have more type 2 diabetes in the heavier children or children with weight issues. So that's where the weight and diabetes comes in. But type 1, smaller stature and more weight loss would be a symptom.
Yeah. Well, what would you say, because you brought this up earlier, and I know somebody did message me to ask you this question, when I knew you were coming in, mentioned that I would be interviewing somebody from HSA and, of course, your role. And they said, at what age do you think that you should be very concerned if your child is still peeing the bed?
Oh yeah, that's a good question. Around age 7, 8, 9, children still wet the bed. 11 years old, you can still have 12, one mishap, around that time. It runs in families, actually.
Yeah.
So you might hear daddy or mommy or somebody was
Did this,
but
yeah.
we just don't go around saying, boy, I used to wet the bed. And I was, that type of thing. But it does run in families too. So a proper history is important. Yeah. And then, if it's really causing too much a concern after a child is, heading into high school, 10, 11 years old, year 7 and so on. And then it sometimes can cause, psychological trauma.
Yeah.
They're feeling bad about it, etc. You want to do what it is. The most common thing would be probably in children would be if they have a urinary tract infection or something. So you want to rule those things out. Do a urine culture, urinalysis, etc., an ultrasound of their bladder, etc. It's worrisome. But having a few accidents, up to, it's common.
Yeah.
It's common. Some children wet every night, and I should mention in terms of water intake, what we're finding a lot is because we in a hot climate, hot tropical, and those temperatures are excessive.
Yeah.
Everything is excessive these days. The viruses, the bugs, everything. The prices too, right?
Yeah.
But
obviously.
What we're finding is that the children are not drinking enough water. So they're running at a water deficit during the day.
Yeah.
And then they try to catch up at nights. And in the evening, they try to catch up. They're thirsty when they get home now because they haven't drunk enough water during the day.
Yeah.
And they fill their bladders, and that bladder is just empties in the bed at night. So I advise parents to, if your child is wetting the bed too much, make sure they're wet during the day and dry at nights. What we find is they're dry during the day and wet at night, so wet in the bed at night. So let them drink a lot of water during the day, empty their bladders, drink all that water during the day, keep wet during the day, drink a lot of water, be wet.
Yeah.
Empty your bladder once, twice before bedtime and be dry at nights, and that will help a lot with the bed wetting. But we find a lot of time they're not drinking enough water during the day. They're well dehydrated. Then they fill their bladders at nighttime, drink a lot of water, and that is emptied on the bed.
Yeah. And it's true.
Also.
It's true. This is really good. I'm pretty sure there's a lot of parents right now that's taking this information in and finding it extremely useful. I know I am. It's been a wonderful conversation. Antibiotics seems to be one of those subjects that is very, very, very misunderstood. I think the question to ask here, doctor, is when do you actually need it? When should a child be taking this?
That's a good question.
Yeah.
That's a good question. I mentioned earlier that we don't want to overuse antibiotics because a lot of the common infections and the seasonal ones are viruses. And we don't use antibiotics against viruses. If it's a virus that has an antiviral agent against it, we'll use those. And there's some viruses for the flu, influenza, we can use an anti-flu agent against the flu, etc. And some viruses. We don't want to overuse antibiotics because you can develop a lot of resistance if it's you using an antibiotic against a virus.
Yeah.
Then when you want to use that antibiotic in the right circumstances, it's not efficacious, and therefore you run the risk of that person becoming severely ill by having a bacterial infection and an antibiotic that is not useful. So we try to find that balance over use of antibiotics and using it at the right time. Mm-hmm. What we've been seeing, however, is things like the flu, influenza, the regular flu, after the virus breaks down your immune system and lots of mucus build up in your lungs and all over, you can have a bacterial infection, a secondary bacterial infection. Therefore, a lot of time when we admit, a child to hospital sometimes, along with an antiviral agent for the flu, we sometimes we have to give them antibiotics because by this time now they have a secondary bacterial infection. So we see viral infections moving and crossing that spectrum from just a viral infection. The systems are all broken now. Your immune system is all broken now. You have secondary infection with bacteria. You need a bacterial infection. So a common cause of morbidity and mortality in influenza is, pneumonia, which is a bacterial pneumonia, and you need antibiotics. By the time a child reaches hospital and they're so unwell, very often they might need antibiotics.
So just think about that. That's something to consider, because I know this is something that as a lot of parents, especially here in the Caribbean, I have to pick on my own Caribbean people. We tend to always say, just get them the medication. Let's just use it. It fixes it. This is what doctors have always said. I know what he's going to say. I'm going to play the role of doctor. And how dangerous can that be? Because that can actually be something that can actually end up to be something worse that will actually bring them to the doctor eventually. If they say they know exactly what their child needs, so I'm going to give them the antibiotics.
Oh, okay. Yeah. You don't want to overuse antibiotics. Lots of side effects from antibiotics. You can have severe side effects.
Absolutely.
And we don't want to overuse it at all.
Love that. Love the information. We have Dr. Swan here from HSA. We're having a beautiful conversation here. We're going to continue it right after this short commercial break.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Welcome back to the program. Welcome back to Bobo. My name is Dane, and of course, we're here with HSA, and we're interviewing Dr. Swan. Doctor, why don't you tell him your role again at HSA and what you do?
I'm a consultant pediatrician. We look after the children and outpatient department, the inpatient department. We look after the babies also, and we see children also in the emergency department and the urgent care sometimes.
Love it. So, and you've been in the industry for how long?
I've been a doctor for over 2 decades, and most of that time has been in pediatrics.
Love it. This is the next important question that we're going to ask you. We've had a few questions that we have gone through, and a lot of parents have been finding this very helpful so far. But here's the next one that I think it's one of those things that I want to kind of feel that parents want to know about. Many parents turn to over-the-counter medication for symptom relief. Are there any common mistakes or precaution they should be aware of when doing this?
Some of the over-the-counter medications can be useful, and Pyrexial medication for fever and pain, a little paracetamol, ibuprofen, we have medicines with a little bit of honey and garlic in it these days. So instead of you having to do that at home, you pick up one in the pharmacy, and some cough medicines. Most of them offer a little symptom relief. And sometimes it's more convenient than coming to the hospitals with, long lines, etc., and time away from work. So there's a place for over-the-counter medication. But you'll notice that if that child does not respond within 1, 2, 3 days, you need to seek further help. You'll allow for a cold, a cough to last a week, probably, if it's not getting worse, etc., and you're doing what you should do. They're not having fever. They're still eating and drinking. They're still bubbly and playing around, etc. And if they're still on just a cough, you will probably continue that over-the-counter medication. I mean, a high fever and a child not his usual self, not eating or drinking. A child who is not eating or drinking, that's an unwell child in most cases. I mean, but once you're unwell, you will stop eating or drinking. So a poor appetite in the first hours is not a bad thing. It's how your body protects itself from, But after 2-3 days of that, it's need to be checked out.
Yeah, I agree. Definitely well said too, Doctor. I think one of the things, I think you answered this earlier, but for our new listeners, anybody that's just joined for the first time, anybody that's been told about the program and maybe they want to learn some more themselves, we'll go ahead and obviously have this available for you to listen back to. But if you want to hear some information now, or probably this question was answered before, but some parents are worried about their child getting sick too often. Now, how do they know what's normal and what they should be concerned about, especially when it comes to frequent infection?
Yeah, it's always a good question. I think my child is getting sick too often. In the preschool years, as we mentioned, the younger ones under the age of 6, 7, they share their bugs all the time. And they get about as much as 8 to 10 infections a year.
Wow.
In that age group. The younger ones, even more, 2, 3 years old, who we said, don't have cough etiquette, know how to control infections. Lots of sharing of toys, contaminated toys. Their tables in school are contaminated.
Yeah.
And, they share even their lunches and their cups and everything is shared. They're so loving little kids. They share everything. And so in that age group, you have lots of, infection. And those little kids come back with as much as 8 to 10 bugs, infections per year. So it looks as though they're sick every other week.
Yeah.
That's how it looks, I mean, if you're not sleeping at nights, your child is coughing, they have a fever, and it might be once, probably every 2 months, but it looks like once every 2 weeks at the frequency because it's still on you and it still traumatizes you. But that child is allowed to have that amount of infections. You'll be concerned if the child is probably not growing well or thriving, losing weight. If that child is, if you have a family history of some immunodepressant condition that might predispose to infections, if the child have any other chronic illness that might be predisposed and is on some medication affecting his or her immune system. So you'll be concerned that he is getting sick too often. But that child, most of the young children, preschool, are allowed to have as much as 8, 10 infections a year.
Oh, wow. That's a high number.
It is. It is really. And in most cases, it's mild. So a little cold here and there. But the more they are in preschool and, I know they do a lot in the preschool to prevent infection, sanitizing, cleaning, exclusion from school when the kids are sick, etc., just to combat that number of infection. But the good side to that, there's always a good side. It boosts their immune system for the future.
Yeah, that is true. I want to ask, though, it's been wonderful having you on the program. And we're coming to our very last question now before we end the show and wrap up. But I want to ask, of course, kids are going to be going into midterm breaks very soon. Easter break that's coming up. With children, going into school now and coming into the household, how can parents prevent the spread of illness within their household? Obviously, the kids are going to be spending more time at home, but eventually they're also going to be returning back to school. They're in school now. So just want to know how to prevent other folks. You probably have a household full of people. You have more kids. How can you make sure you avoid having 4 kids sick at the same time?
It's interesting. I'll say something that you might not find in the medical books here, Dwayne. During the flu season, influenza season, a lot of the spread of infections is because of you're indoors. You're locked in. You're more indoors. Like in the winter months now. If you're in the winter month in Canada where it's minus 40 or minus 20 and somewhere there, you're indoors mostly. Outdoors is hazardous. We have warm temperature. We should be more outdoor here, outdoors. So like I would say, you probably didn't hear this recommendation before, but let the children be outdoor more. Let them get out there and have some fresh air. Get off of those iPads and computers, but that's another subject we'll talk about some other time. Let them get out there, breathe, take some run, jump, exercise their lungs, etc., and that will help. Along with the common things, hand washing, cough etiquette, avoiding crowds and clusters of people. If you're unwell, try to isolate as much as you can, etc. And as we mentioned earlier, just boosting your immune system with good nutrition, adequate hydration, etc. Yeah.
I love it. This has been such a good conversation, and needed for me too, because like I said, I have a household of 3 kids in there, and a lot of times we always feel like running to the doctors and what do we look out for? How do we avoid colds and flus? So it's an important topic today, especially because it's since January started, I felt like everybody.
Oh, absolutely.
Everyone,
all of us.
Everyone. I got sick during the holidays. So on Christmas Day, I had the flu. I kind of felt it was because I was going from the hot weather going into the cold weather. I don't know what caused it, but it was bad. I think I was in bed for about a week.
It's common right now for us to have children admitted on the ward, or just admitting the children to the ward, and their parents down in the emergency department being admitted also with the flu and viruses. It's really rampant. It's a cause for concern.
Yeah, this is normal for you as a doctor. You see this every day, around this time at least. Dr. Swan, anything else that you would like to add? How about how a parent can get in contact with you or the hospital, or any last minute message that you would like to input before we wrap the show up?
Yeah, we are the pediatric department of the Health Services Authority, 95 Hospital Road. The number is 949-8600. And you can call us anytime, make an appointment. We'll be happy to see any children. We have acute, or what we call walk-in clinics. It's good to call the nurse and get an appointment. Sometimes it's overscheduled. Acute clinics most days. And then we also have clinics by appointments at the HSA Pediatric Department.
I love it. Absolutely love it. Thank you so much for being a part of the program. And I do hope you have a wonderful week.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.